I want to tell you, for example, in Jerusalem, I see many people. In Jerusalem, the health system is an Israeli health system. People come to see me in my private clinic because they don't trust the health system. They believe that when Israel exports spying software to the whole world, so we don't feel safe in the Israeli health system. So they come to the private clinic and they ask me sometimes to take my mobile outside, to take my computer outside, and I understand where this comes from. And those are not paranoid patients. Those are people who have a reason to worry about the authority. Another example from Jerusalem, I support some psychologists who work in the school system in Jerusalem. When a child dies in school, when a child gets killed by the Israeli army, the psychologist should, of course, this child is referred to by his colleagues as a martyr, and they say Allah yarhamu. But the psychologist who is employed by the Israeli system should hush them, is expected to hush them. And if she doesn't, and if she uses the word martyr, that will get her in trouble. In the West Bank, of course, there is trauma, but less intense than in Gaza. And within the West Bank, there are different geographical areas, area A, B, C. And in some areas, for example, the big problem is the encounter with the settlers and the settler violence. Detention is very common, and Dr. Ruqayya spoke about the impact on the child, on the family. And I think child detention is orchestrated, is engineered to break the power, the capacity, the agency of the child, and to inject guilt in the family. In Gaza, we don't see patients, because Gaza has been closed for a while, so the experience of detention in the young population is not an issue. But of course, traumatic grief, because many of the people there lost more than one family member in the multiple atrocities and bombardment that happens every couple of years in Gaza. And so they have both symptoms of grief and trauma. And the numbers are huge. So most of the interventions and the resources, mental health resources, are limited. So the way we work there is we rely a lot on other people in the helping profession, mainly teachers and school counselors. We established mental health units within the school system. And after each atrocity, teachers are trained to implement like psychosocial support for children in groups. And they are trained to identify symptoms that require more clinical intervention. So they try to help children through 5 sessions, and they can identify those who need more clinical work. So that's the difference between